in the clinical guidelines and public health literature, acute means a first time onset that is less than 3 months. That's what it means. So if you're having back pain for the first time and you've only had it for a couple of weeks, that's acute. Whereas for us, we're going to get more precise and we're going to say acute means it's not yet healed. There's still damage in there. Okay? So typically what they say is in the guidelines, and we're going to read this in a minute, it says acute is up to 6 weeks. So that little chevron there, okay, the little side of it means it's little and the big side means it's big. So the acute phase is littler than or less than 6 weeks. So it just means less than 6 weeks. Okay. And subacute is 6 to 12 weeks. And chronic is greater than 12 weeks. 12 weeks equals 3 months. So that's kind of like the textbook definition of acute versus chronic. So like I said, that's useful if you're a public health researcher, etc., but it's not that useful in the clinic for us. So what we want to know is about tissue healing times, because that's actually more useful for us. All right, different tissues in the body heal at different speeds. If you have an injury to your skin or muscle, that heals very quickly. Typically, if you have a minor muscle strain to your calf or something, that would heal in 4 to 6 weeks, even 3 to 6 weeks, depending on how severe it is, and how old you are and a bunch of other things. But typically, we're thinking if there's a muscle injury, it's going to be 3 to 6 weeks back to full function. And that's kind of the consensus within the literature. So if a client comes to you and says, I tore my hamstring, what do you reckon is going to happen? Well, unless it's like they've avulsed it right off the bone and it's just, flopping around in the breeze. If it's just kind of ouch, it's a bit sore, I can still weight bear on it, but it's, it's not quite right. Well, yeah, a month or so, you'll be back playing soccer, running and doing all those things you love. Okay? And that is the same for skin, by the way. Like if you cut your finger, you expect a couple of weeks later, it's basically good as new. Bone, we talked about yesterday. If you break a bone, if you break your arm, how long would you expect to be in a cast for? About 6 weeks, 6 to 8 weeks. A bit longer for bigger bones, longer if you're older. If you have, slower healing for whatever reason, there's variation there. People heal at different speeds, etc. But the general kind of range is 6 to 8 weeks for a bone. And then we have connective tissue. And connective tissue, otherwise known as fascia, otherwise known as ligaments, tendons, joint capsules, discs, all of these things are the same stuff. They're made of the same material. So they'll heal at about the same rate. So I'm just going to call it ligaments and tendons because those are typically the things that we injure. Ligaments, tendons, discs, they're all the same stuff. Connective tissue, and they are 12 to 18 months. 12 to 18 months for those tissues to heal. Like, anyone ever ruptured an Achilles tendon? Okay. You're in a boot for 6 weeks, but then you're not back to full function for a year. Okay, even then you're not quite right. So 12 to 18 months. All right, and that's just simply because muscle has a lot of blood supply. Got a lot of veins, a lot of arteries, a lot of arterioles, a lot of capillaries. There's lots of stuff happening there. It's got lots of nutrients. It can heal quick. Bone has less blood supply, but still a fair bit. Okay, ligaments and tendons have very poor blood supply. So they're kind of sluggish. All right, so if someone comes to you and says, I strained my hamstring last week and it still hurts, what would you say to them? It's Probably normal, right? The pain serves a useful function. It's telling you, hey, just be a little bit gentle with that hamstring because it's not quite right in there. It's still fixing itself up. Okay? But if they come to you and say, I strained my hamstring 6 years ago and it still hurts, well, that's kind of weird, isn't it? Right? Because whatever healing is going to take place has taken place. Right? So there's no longer a tear in there. It's all scarred up and repaired. Okay? So we now no longer have a tissue damage situation. We have a chronic pain situation. Make sense? I broke my arm a month ago. It still hurts. Probably normal. It's probably not desirable to get rid of the pain because the pain's... Why do we have the pain? Why is the pain useful? Right. So you don't go arm wrestling and hitting a punching bag and doing all those other things that wouldn't be very good if you had a broken arm. Okay? That serves a useful function. Broke my arm 2 years ago, still hurts. That's a pain scenario. It's not an injury. Does that make sense? Ruptured my Achilles tendon 6 months ago, still hurts. Normal. It's still healing. It's not fixed yet. You've still got a partially injured Achilles tendon. Okay? Blew out my disc 8 months ago, still hurts. Probably normal. Still healing. Make sense? Blew out my disc 20 years ago. Chronic pain. Not a disc injury anymore. Coolio? So this is kind of the textbook definition, but in terms of clinical use, okay, it's much more useful to think about a muscle. Anything over 6 weeks is probably chronic, right? 8 weeks for bone, but for ligaments, tendons and discs, it's more like a year. If it's less than a year, it's probably acute. So this tells us whether we need to modify, take it easy, respect the fact that there's an injury, okay, or whether we can go, there's no injury in there. Yes, you've got pain. Yes, you've got fear. Yes, you've got weakness, inhibition, tightness, all of those things, but there's no damage in there anymore. Make sense? So this allows us to make a judgment about should we load it or should we not load it, essentially. All right, so people do have injuries, but often people will come to you and say, yeah, I hurt my back X number of years ago, right? And it may or may not have been an injury at the time, but by now it's certainly not an injury. It's now a chronic pain scenario.